what nursing school is like. So maybe one of these days I can look back and see if I say the same thing about medical school, or some of the same things. So nursing school is 2 years long, or it was for me. It was 5 semesters, and I'm pretty sure it's like that for about every school you go to. I went to a community college, so it was 2 years period, but you did have to have like 1 to 2 years of prereqs, and I discussed that in a previous video. But even if you're in a bachelor's program, the actual nursing part of the school is going to be 2 years. You actually have to do your freshman and sophomore year, then you have to apply to nursing school, which you enter in your junior and senior year and complete. So whether you have a associate's degree or a bachelor's degree, it's still going to be 2 years of schooling. The school itself, the first semester is generally your like basic classes, your foundation classes. You're going to have Foundations of Nursing 1. I think I did Foundations of Nursing 1, Pharmacology, and there's one other class that I can't remember, but there was 3 or 4 classes the first semester, and they kind of get you started slowly. They get you used to taking nursing style classes, which is a little bit different than your regular classes. You know, like a general chemistry class, you're going to have like an ABCD multiple choice question, and one of those answers is going to be absolutely correct. Well, nursing school, they teach you how to take tests in which you're going to have 2 questions. You're going to have 4 answers. 2 answers are going to be incorrect but plausible if you didn't study, so they confuse you there. And then there's going to be 2 questions or 2 answers that are correct, and 1 is more correct. And they also have something that they introduce you to in nursing school called multiple multiples, which are tested on the NCLEX, which is the licensing exam that you have to take at the end of nursing school, or after the end of nursing school. And those are essentially questions that have multiple correct answers. So you're going to have a question on what type of complications could a diabetic have, and there's going to be like 5 answers, and you're going to have to choose however many are correct. They don't tell you how many are correct. 1 could be correct, or all 5 could be correct. There could be like, skin breakdown, poor peripheral circulation, increased risk of ulcers, increased risk of diabetic ketoacidosis, things like that. And you would have to choose every one of those answers to get that entire answer, or that entire question, correct. So after the first semester, we started getting into our specialty classes. I think it was like medical surgical nursing, obstetrics and gynecology nursing, which they called mother baby, pediatric, and mental health nursing. Those are our like 3 or 4 specialty courses that we took that were basically on a niche of nursing. I haven't really used a lot of my mother baby skills. I have a feeling I'm about to, since I'm about to have a baby, but and I remember very little from those classes. All I remember is massage the fundus, and if you're a nurse watching this, that should make you laugh, because that's all I remember is massage the fundus. And for babies, don't stimulate baby, because baby will cry. After you get through your specialty classes, that's how my school was done. I don't know if all schools do that. You're gonna take your second year classes, which are basically built on the building blocks of your foundation classes, so they're a little bit more complicated. little bit more in depth. You deal with some more complex disease processes, some more complex pharmacology questions on the tests, and then hopefully graduate. As far as grading goes, most schools require you have a C or higher. The saying in nursing schools is C's get degrees, but don't listen to that. Try to get as high as grade as possible, especially if you are trying to go to CRNA school in the future. If you're trying to be a nurse practitioner, if you're trying to be a clinical nurse specialist, they look at GPAs, and a high GPA in nursing school is something difficult to get. At least it was at my school. My school was an ABC DF kind of school, so it was a 10-point grading scale. And I always seemed to get like an 88 or 89, so I really wish they did B pluses. That really would have helped my GPA applying to medical school. But hindsight's 20/20. So really try to get the best grade possible. I know that goes without saying, but some people goof off in school and don't do very well. Some other things, early clinical involvement's pretty common in nursing school, so you're gonna be in clinicals starting the first 6 weeks of school. I forget where I did my first clinicals. I think it was a general med surg floor, and that was really my first exposure to actually being in a nursing role. I had worked on several nursing units in the past as a CNA, and I worked as a telemetry tech on a unit during nursing school, so I knew what it was like kind of to be a nurse, but that was nice that they kind of throw you into the clinical environment pretty early, and that continues throughout the entire nursing program. When you get into your specialty classes, you'll rotate on pediatric floors, you'll rotate on mother baby, you'll get to go to labor and delivery. It was a choice for the students whether you went to the NICU or not. I didn't go to the NICU, didn't really want to. But yeah, so nursing school is fairly hard while you're in it. Looking back, being an actual full-time nurse is, I think, more physically and mentally demanding than nursing school ever was. And the professors will tell you, nursing school is hard, but being a real nurse is harder. And I really didn't believe them, but being a real nurse is pretty difficult, but it is a fairly rewarding career. It is a very wide open career path. I mean, you can do anything. You can sit at home on your computer and basically be a nurse for an insurance company, just checking in on patients, making sure they take their meds. You can be a tele-nurse watching telemetry for patients at home. You can be an ER nurse like me, ICU nurse. You can work on a med surg floor. You can be a case manager. You can work in an urgent care. You can work in a doctor's office. You can do hundreds of different specialties, or you can go back to school, be a nurse practitioner. There's several different fields of nurse practitioning now: acute care, geriatric, oncology, pediatric, women's health. So, or be a CRNA, clinical nurse specialist. I mean, the sky is the limit when you're a nurse. Or you can go back to medical school like me, because it looks good on a resume. But yeah, if you have any questions or you like my videos, give me a follow. Subscribe button's down below. And if you have any questions, like I said, just post them and I'll see if I can get back to you as soon as I can. Talk to you later.